Today, I'm going to talk about and break down what happens with your injury claim after a car accident, specifically the medical treatment. Hi everyone, I'm Rose Harper, a personal injury attorney here in Lehigh Valley, Pennsylvania. I also handle cases in New York and New Jersey in addition to Pennsylvania. So really, whether you were in a car accident, slip and fall, trip and fall, or other type of accident, the way that you treat, and especially how consistently you treat, plays a huge role in the outcome of your case. In this video, I'm going to break down why consistent medical care matters, why medical testing is essential, and the dangers of having gaps in treatment. Also, why documenting every medical recommendation puts your case in the best position possible. Stay with me because understanding this will help you to protect your health, most importantly, and also your legal rights after an accident. Let's start with the most important part. Your health always comes first. After an accident, your body is in shock. Adrenaline can mask pain. People sometimes might feel fine at first, and then symptoms show up days or even weeks later. Headache, back pain, neck pain, numbness, dizziness, inability to move certain body parts, you name it. When you get medical treatment right away, you protect your health and you catch hidden injuries earlier. Creating documentation that shows the accident caused your injuries is also really important. From a legal standpoint, medical records are the foundation of your case. Without them, it's almost impossible to prove the injuries came from the accident. Insurance companies look at your medical records under a microscope. They're not just checking for what injuries you have, they're checking how consistently you treated. If you go to the doctor once and then disappear for 3 weeks, an insurance adjuster will say, well, they must not have been seriously hurt. They would have been going to the doctor. They didn't even follow up for medical advice or medical care. And they have this big gap in treatment now, so their injuries can't be serious. But the truth is, people stop treating for many different reasons. Maybe they're caring for another family member or children. Maybe they're starting to feel a little bit better. Maybe they don't have transportation. And maybe they just don't understand the importance of consistency. So even if they're having pain, they're just working through it and ignoring the pain. From both a health and legal perspective, treatment gaps are one of the biggest reasons claims get undervalued. Consistent treatment equals a more credible injury in the eyes of the insurance carrier, and gaps in treatment produce doubt and reduce compensation. A lot of serious injuries cannot be seen with the naked eye. You may have herniated discs in your spine, nerve damage, brain injury, torn ligaments, soft tissue injuries. You can't see those from the outside. So the only way to confirm them is through diagnostic testing like X-rays, MRIs, CT scans, EMG nerve damage studies, and the insurance companies love to say there's no objective evidence of injury. Medical imaging shuts that down. If your doctor recommends testing, follow through with that immediately. Delayed or skipping testing gives insurance companies an excuse to claim that the injury is exaggerated or unrelated. One of the biggest mistakes that clients make is not getting their symptoms and limitations properly documented in the medical records. If you're feeling pain, tingling, anxiety, difficulty sleeping, inability to work, trouble lifting or walking, that all needs to be documented. And if you get put out of work, the doctor should give you a medical note saying that you cannot work due to your accident-related injuries. You don't just not go because you're injured. You should go to the doctor and get that note. Make sure you report all of your symptoms to the doctor so that they can properly document it for the records. If it's not in the records, then the insurance company is going to try to say, well, that's not real. Why didn't they tell the doctor? Or why didn't the doctor note it? It wasn't important. So try to make sure you relay all of your symptoms to the doctor, including your pain levels, your functional limits, your emotional challenges, worsening or new symptoms as well. As the doctor will then document all of that and document the recommendations they have based upon, your symptoms, the imaging, the physical tests that they're doing on you. They might recommend medication or seeing a specialist. Life happens. So if you absolutely have to miss an appointment, that's okay. Make sure you call ahead, reschedule immediately, explain the reason to your doctor. Make sure that the gap in treatment isn't too long. One missed appointment is obviously understandable, but multiple missed appointments become a red flag in your case. Insurance companies use formulas that heavily factor in your total medical treatment, the length of time of your treatment, the objective test results, consistency, and gaps. When you're consistent, your case is stronger. Clients who follow medical advice and document their symptoms recover significantly higher settlements than those who don't. If you've been injured in an accident, the most important thing that you can do for your health, first and foremost, and also for your case, is to get medical treatment, stay consistent, follow the recommendations, get the testing done, avoid any gaps in treatment, and make sure that everything is documented. Of course, follow your doctor's guidance. If you don't need those things, then don't. But if you do, then you should, because your health is important, as is your case. If you need help, contact roseharperlaw.com. We're here for you. This is educational information only.